biggest advice I can give a physical therapy student starting their first clinical is to not be a know-it-all. Don't be a jerk. Don't come in there acting or thinking that you know it all. And I'm saying that because I've been a clinical instructor since 2021. I've been a physical therapist since 2018. I've been coaching pre-PT students technically since 2014. I've been a PT student myself. I've been a pre-PT myself. Who's been doing observation hours myself and clinical rotations myself. I've been through almost all of what you're going through right now. And I'm saying don't be a know-it-all and a jerk is because that's something that we can't teach out of you, and it's something that just makes the entire experience not pleasant for the instructor and the student and the patients. Because we can teach you almost everything else, but it's hard to teach character while teaching clinical information and administrative duties. It's just a huge obstacle and barrier that doesn't need to be there and takes away from the other stuff we're trying to teach you. Because one of the biggest barriers to learning is thinking that you already know it all. And I don't care what you think you already know or what you actually do already know or think. I don't care what other CIs have told you, what you've seen on social media from other clinicians, what you've experienced yourself if you're coming from another profession. There's always something everybody can learn more of. That's how we continue to get better. I continue to take CEU courses, meaning continuing education courses. I listen to other clinicians. I watch other videos just like you and hone my skills to get better, whether it's with patient conversations or clinical modalities or thought processes or treatment styles. I continue to get better myself. So if a student comes in there like thinking that they know everything from whatever book they read and they're like, no, it's not like this, it's not like, I'm like, interesting. And it's just another barrier to get over, as well as teaching you administrative work, as well as teaching you how the clinic runs, as well as teaching you different treatment processes or thought processes, as well as getting the CPI done, like all your assessments done. We don't need all that. So just go in with a good attitude and open to constructive feedback, and we can teach you everything else. We can take care of almost everything else, and you'll have a great experience. We know you're nervous. We know that most of you want to learn a lot. We know that you think you don't know what you're doing. We're there to give you confidence. We're there to help you, to be your clinical instructor, and we know for the most part what you're already going through because we've been there at some stage already. So that's one of my biggest pieces of advice that I'd give you going into your first rotation. Good luck.